I think one state could make a really big difference depending on what they do. And the hard thing is, anytime you're talking about what the states can do with health care, is that the federal government sends a lot of dollars to the state in Medicare dollars, and every single one of those dollars and every penny has a big string attached to it. It has to be spent in a certain way. So it would be hard. But could one state make a difference? Yeah, they could make a big difference. It would have to take some courage and have to take some forethought. But I think one state could make a big difference.
Okay. And what about the first policy decision, not to set up our own exchange?
Well, I think that was a very good idea. I mean, you look at also. I mean, look at what just happened in Oregon. They just shut their whole system down. They shut down their whole state, everything about it, and said, forget it. Yep. We just spent $50 million or more than that. Same thing in Minnesota. They haven't quit on the thing. Don't get me wrong. But their computer program system, their internet portal, has been so bad that they actually just shut it down and said we're going to have to. They spent millions and millions of dollars on something that didn't work, and they're going to have to either spend millions of dollars to fix that or millions of more dollars to build a new one because it was operating so poorly. So I think for the Wisconsin, just for the state taxpayer to refuse the money to go, went for increasing MA and to not build up our own exchange, I think was a very good idea. Well, one thing I would do is, the number one thing you have to do is just start cutting some of the government burdens. I don't know why I call them regulations. The burdens that are on the physicians and the providers, healthcare providers. And this is one of the things that we talk about. We spend so much time being data entry people on a computer, doing a job that is, low skill, and you're taking the people who are the highest skilled, the highest workers in a hospital, in a clinic, and saying, here, let's have you do this low-skill job. You're really well-trained to do something else. You're really well-trained to be with patients, to take care of patients, but let's have you be a data entry clerk. I think one of the health care issues we have is, there's a older rural population. And I can't say that this is only unique to Wisconsin, because I think you see the same thing in Minnesota and parts of the Dakotas and some other places that have been historically large farming communities. You have a rural population with these elderly people who are farming or are still even farming. And as time goes on, they're going to need more health care, and they're going to need more health care access. And we're actually driving that in the opposite direction in many ways.